Hi, good morning. It's me again, Passent, and I'm raising awareness about cutaneous T cell lymphoma, a very rare type of lymphoma that I've been diagnosed with in 2008. So I spoke before about the diagnosis and the do's and don'ts. And today I would like to share with you the treatment strategies that might be available for you if you are diagnosed with cutaneous T cell lymphoma or one of your family members. So there is a very long list coming to the treatments available now, especially for the early stages and for people who are having a mild form of the cutaneous T cell lymphoma. A long list to choose from, whether it's a skin directed treatments or a systemic treatment. When does you need to know about this kind of treatments and what type would suit you better? There is always this kind of, I call it combos. So it's a combo. Whether you would like, whether the doctors see the stage that you are in needs a systemic medication, or maybe you need only a skin directed medications. The cutaneous T cell lymphoma, unfortunately, makes the white blood cells act a little bit weird, and the malignant cells see the skin as a foreign body and starts to attack it to the extent that form rashes, which you can see it as patches at the beginning of your diagnosis, or if you are in early stages. Later you're gonna see it as plaques, and still if it is a plague, this doesn't mean that you went to a third or fourth stage. Still you are in the first and second stage, and then it might form some tumors or result in a whole body change in color, and it will be more of reddish scaly skin. So at this point, when the body like doesn't accept the medications at the early stages, and failure comes after failure, then the doctors will offer you more of an immunotherapy medications, and also some chemotherapies. There is lots now of chemotherapies that are available for trial, and also there are a few that are already approved. So there is more options, I think, more than 10 years ago when I was diagnosed. And there are more experts in Europe and in different parts of the world who are interested in the research work and in treating cutaneous T cell lymphoma patients. I was fortunate, of course, to meet one of them here in Sweden. And I say this because when I met him, the doctor, I used to take a second opinion from different parts of the world, to the extent that I went to China with my husband in order to take a second opinion. So we were really running after a relief and a team who I can trust and I can feel safe with. And I think after 8 years, when I met the team in Sweden, I felt safe, and there was like a very smooth channel of communications between me as a patient and the medical team. And this, I think, was a turning point in my medical strategies. The most important thing is that you need to be proactive, so you need to do your homework. You need to research, you need to ask other patients, you need to be in contact with patients from all over the world, and this is very easy. There is many patients available on Facebook pages, and also there is forums that are under Cutaneous T Cell Lymphoma Foundation. They have an excellent website with excellent information. available, and you can access it very easily. They even have a list of specialists in different parts of the world who are specialized in cutaneous T cell lymphoma. So make your homework, do your research, and choose whatever is best for your lifestyle. And I hope this video will benefit you, and you can use this information in choosing your medical plan. Stay tuned. I'm coming with the next video. I will speak about a very sensitive issue, which is caregivers. Stay tuned. I will be back.